Whenever you're ready, mate.
Okay, good morning. My name is Shiv and this is Randy, and I'm going to perform an examination of Randy's right knee. For the purpose of this examination, I'm just going to focus on the right knee, not the left knee, because of time constraints. So Randy, what I'm going to do is just start by looking at your knee, asking you to do a few movements, and if there's any pain at any point, just stop me and let me know. Do you have any questions before we begin?
No.
Okay, fine. And during the exam, I'll be speaking to the camera just to let the examiner know what I'm doing. So to begin with, can I start by asking you just to walk in that direction? So turn around, walk in that direction, and then turn towards me and walk back. And when I'm doing that, I'm inspecting the gait, looking for any evidence of an antalgic gait. Doesn't appear to be any of that. Can I get you to just lift up your short slightly for me? So just inspecting anteriorly, comparing both knees, looking for any obvious asymmetry, looking for any obvious effusions or swellings, any looking at the quadriceps bulk for any muscle atrophy, and looking for any scars or deformities suggestive of a previous operation. Then move over to the lateral aspect, and I'm doing the same here, looking for any obvious muscle atrophy and deformity. Posteriorly, again, looking at muscle bulk, any evidence of any swelling, for example, suggestive of Baker's cyst. Doesn't appear to be any of that. So the next thing I'd like you to do is just to assess function. I'd like you to just slowly sit down onto the sofa and then slowly stand up again for me. And that all appears completely normal. And the next thing I'd like you to do is just to lie down for me. Okay, so can I get you to just flex your knee for me, lifting it up? Yeah, that's perfect. And when I'm doing that, I'm looking for a posterior sag. Doesn't appear to be any of that, which should be suggestive of an intact posterior cruciate ligament. And that completes the inspection process. So now I'm going to start by palpating the margin of the patella. Stop me at any point if you have any pain. I'm feeling over the tibial tuberosity there. Fine, that all appears normal. Can I get you to flex your knee for me again? And just all the way down there. And now I'm going to feel the joint margin on the lateral femoral epicondyles and posteriorly into the posterior compartment, looking for a Baker's cyst. And that all appears normal. Any pain when I'm doing that? Okay, fine. Okay, you can just relax your knee down for me. So that completes palpation. So now active movements. Can I get you to flex your knee as far back as you can? Fine. And extend it out for me. Okay, and this time I'm going to do the same thing for you. And again, stop me if there's any pain at any point. As I'm doing this, I'm just feeling for any crepitus and full flexion up to 140 degrees and full extension. That's normal. This time I'd like to do the same movements except resisted. So if you flex your knee for me and kick out towards me, and then pull your leg in towards you, and that's fine, that's completely normal. So that completes the active, passive and resisted movements. I'm now going to move on to assessing the lateral and collateral ligaments. So as I do this, just relax your leg for me, I'll take the weight. So I'm placing my left hand onto the lateral aspect of the knee, and I'm applying some valgus pressure, and that doesn't show any evidence of laxity, and the other way, some varus pressure, and both lateral and medial collateral ligaments are intact. So get you to flex your knee for me. I'm going to sit on your foot. Is that okay? So as I do this, I'm placing my thumbs over the tibial tuberosity and my fingers behind the knee. I'm going to apply some pressure, pulling towards me to assess the anterior cruciate ligament. There doesn't appear to be any pain there. I'm going to press posteriorly now. And there's no evidence of any posterior cruciate dysfunction. So that's the anterior and posterior cruciate ligaments. One thing I forgot to do was to examine the patella for any effusions. I'm just going to jump back and do that. And as I do that, I am sweeping from distal to proximal and doing a patella tap. And there's no evidence of an effusion. This time we did a sweep test, looking at the medial compartment, and the dimple remains. There's no evidence of a patellar effusion. So going back to my special test, I've done the anterior drawer, posterior drawer, the medial and lateral collaterals. I'm now going to do the patella apprehension test. So what I'd like you to do, Randy, as I place some lateral pressure on the patella, I'd like you to flex your knee slowly, and there doesn't appear to be any abnormalities there, and extend it back down. So that's a normal patella apprehension test. The final test I'd like to do is McMurray's test. So can I get you to flex your knee for me to 90 degrees? And when I do this, I'm going to place my left hand on the medial aspect of the knee. I'm going to externally rotate the hip and extend and internally rotate the knee and externally rotate the hip and extend from flexion to extension, feeling for any clunking or clicking of the knee. And that's to assess the medial meniscus. And I'm now going to switch to the lateral side, flex it to 90 degrees, and then apply some internal rotation, feeling the lateral aspect of the knee, again feeling for clicking as I extend the knee. And there's no evidence of any clicking or clunking there. So that completes the special test. To conclude my examination, I'm going to do a neurovascular assessment. Just pop this sock off if that's all right. And so this is what normal sensation should feel like. I'm just going to touch you on both legs. Is that normal there?
Yep.
And close your eyes for me, sorry.
Yeah. 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 Yeah.
Fine. So sensation is intact. I'm now going to feel the salus pedis pulse, which is intact, posterior tibialis pulse, and then finally I'm just flexing knee for me. And the posterior tibial artery is normal as well. So that concludes my examination, my right knee examination. To conclude my overall examination, I'd like to assess the left knee, the right hip and the right ankle, because you can get referred pains in the knee from both those joints. I'd then consider further imaging such as x-rays, CTs and MRIs before guiding further treatment. Thank you.
Taking my sock off like no man's business.